You're live, Commissioner.
All right, good afternoon. Welcome to the Thurston County Board of County Commissioners budget work session for the afternoon session of Wednesday, October 13th, 2021. My name is Ty Menser, Chair of the Board. To my left is Vice Chair Commissioner Gary Edwards, and to my right is Commissioner Carolina Mejia. County Manager Amir Chavez, Assistant County Manager Robin Campbell on screen, and we're in the middle of public health presentations. We had a whole morning of public health and social services this afternoon. We've got treatment, sales tax, emergency management, and Medic One. And Robin, I understood there was a change after that. Instead of next steps, we're going to be...
Instead of next steps, we'll continue the review of commissioners' funds, the other funds,
Okay.
And then we'll just do a very abbreviated next steps on Friday morning.
Okay, so today's session will take us from 1:30 to 4:30 is the schedule. Public can follow along through the Thurston County YouTube channel where this meeting is being live streamed. And I believe that should cover preliminaries. And we will have two breaks, at least that's the schedule, is to take breaks between treatment, sales tax, emergency management, and the final piece of the afternoon, Commissioners' Other Funds. So go back, I guess, right to Shelley Slaughter, our Director of Public Health and Social Services.
Thank you so much, Mr. Chair. Good afternoon again, Commissioners. Today we will be presenting Fund 1180, our Treatment Sales Tax Fund. Carrie Hennon is our Program Manager, and she's going to be walking through this presentation. Carrie is representing the Advisory Committee, some of those members who have joined us today, and Carrie will go through introducing other guests that we have on the Zoom today. Just wanted to share that Fund 1180 Treatment Sales Tax funds many offices and departments, as well as community programs. The presentation that you are hearing today is all inclusive of those requests and recommendations from the Advisory Committee, not just funds that are requested by Public Health and Social Services as a department. And I also have Suzette Smith, who is our Fiscal Manager, joining us today as well to help answer any of those financial technical questions that you may have. And with that, I'll pass it over to Carrie Hennon for the remainder of the presentation. Carrie?
Thanks, Shelley. Good afternoon, Commissioners. Carrie Hennon, Program Manager for Treatment Sales Tax. We discussed this morning that this will be a meaty presentation, so I hope it does not disappoint. Just to recognize others on the call, so Kelsey Paolini is our TST data analyst, has been with us since March and part of all of these discussions. And then we are joined by two members of the Treatment Sales Tax Advisory Committee, Marilyn Roberts and Bob Jones, who, along with the other members of the Advisory Committee, really put in many hours and much discussion to come up with the recommendation that we will present to you today. So I will go ahead and share my screen and switch to presentation mode. How does that look? Okay.
Looks good.
Yes.
Okay. All right. So again, as Shelley mentioned, PHSS administers Fund 1180 Treatment Sales Tax, but this really is on behalf of that advisory committee. So TST is a restricted fund, 0.1% sales tax devoted to behavioral health services. So the statute mentions the operation of our treatment courts, as well as other mental health and substance use disorder treatment and services that support treatment plans. So you see here the members of your Treatment Sales Tax Advisory Committee. I think with my materials, I also sent along a roster, bios of those members, and just want to recognize, again, all their work, but all the amazing expertise this group brings to these discussions. It's truly an honor and privilege to work with them and kind of hear perspectives representing people who have accessed services, people with expertise in actual clinical treatment services, people who work with youth, people who are experts in sort of performance management and program improvement. So it really is a great group of people who spent 8 hours in the month of July meeting with offices and departments, did a massive homework assignment in August, and came back together for almost 10 hours of meetings in September to develop this recommendation. So they worked really hard and asked a lot of questions. So I am just their humble spokesperson today. And we will go through all the work that they have been doing. Okay, so this slide sort of flips, it is a little different perspective than you've been seeing. Usually you hear from one office or department about all the many funds they may use within their operations. Now this is one fund with all the many offices and departments that touch that fund. So as you can see, treatment sales tax is appropriated to a number of different offices and departments. This chart just shows you the expenditures last year, the budget for the current year, and then requested expenditures in 2022 and 2023. So again, many different county offices and departments. You'll see the row for public health down toward the bottom. That includes, as the footnote states, money that goes directly to public health for programming that public health runs and oversees. It also includes quite a bit of funding that is passed through the Thurston Mason Behavioral Health Administrative Services Organization. Heretofore, I will reference them as the ASO. So a lot of that funding is pass-through funding to the ASO, and so you'll hear more about their programming and their requests. So requested expenditures in 2022, about $9.6 million, and in 2023, $10.2 million. And I will say a little more on that as we move forward to the next slide. So this is, I would say, sort of a summary of the financial plan. So the first thing you will note is TST has a significant fund balance. We are estimating that we will go into 2022 with roughly a $6.6 million fund balance. There are many reasons that a significant fund balance has built up over time. Revenue has consistently come in, exceeding our expectations. That has continued to happen in 2020 and into 2021. And spending has always been lower than we've projected. So we've really seen a significant fund balance. The fund balance did increase in 2020 with COVID. Certain programs were suspended or had lower levels of utilization for certain periods in 2020. So the fund balance increased quite a bit in 2020. Significant fund balance. You'll see a projection of high levels of revenue. We're seeing great growth in revenue in 2021, and the projection is that revenue will continue to increase into the biennium. And now, so looking at that proposed expenditure column, the proposal before you today and the recommendation from the advisory committee is to actually spend more than has been requested by offices and departments. And I will go through in detail how we get to those numbers, but I'll go back a slide. So you'll see the requested expenditures were that $9.6 million in 2022, $10.2 million in 2023. The proposed expenditures are $350,000 per year more than that. The goal of that is to impact this fund balance number over time. We know there's a ton of need in our community. We believe that we should spend this fund balance down to address those community needs. So if you sort of extend this level of the revenue and the spending out, by the end of 2024, we'd be down to that kind of 2.5 months worth of cash flow that we think is where we really should be with the fund balance. Robin, do you want me to show in more detail the TST financial plan, or is this summary
The board has
adequate?
in their binder, Carrie.
Yep.
I happen to have it open. If it's under the public health tab, if you want to look at it. And I would just say a couple of things. about this plan. First, the sales tax is coming in just extraordinarily high. And we anticipate that just like in the general fund, it's going to continue that for at least another year and then come back down to more normal growth patterns. But when I first came to the county a decade ago, we were bringing in $4 million a year, and now it's 8. So just tremendous growth in the revenue. And on the expenditure side, what you see, and I encouraged Carrie to go in this direction, there's a lot of opportunity here. So I think that the advisory committee embraced that, and what you'll hear in this presentation are some of the opportunities and ways you can spend this money to benefit the community. I think you're good.
All right, thanks. Okay, I took the liberty to modify the challenges slide to talk about challenges and opportunities because of course we have both and sometimes they are one and the same. And this kind of summarizes a lot of these, again, really meaty conversations that advisory committee has been having over the past couple months. So one, again, as mentioned, TST has a significant fund balance. That said, the committee takes its role of doing a really deep review of all budget proposals very seriously and went into this process saying, hey, just because there's adequate funding to fund every request doesn't mean that every request should be funded. They really looked at it through this lens of what are the most strategic uses of these funds, how can we best meet community needs. So as you'll see as we go through, they are not endorsing every single policy level request, even though we could afford to do so. And then on the other side, they are therefore advancing some additional recommendations for funding that were not even requested. And that, again, goes back to the previous slide about the recommendation is to spend more than was requested. So there's some kind of additional areas, and I will go through in detail what those are.
Carrie, hang on one sec.
Hey, Carrie, can I ask you a question just for clarity for everybody? On the treatment sales tax, can it be used for prevention, education, treatment, and enforcement? Because we've had this discussion before. We started going one way and then the other. So what's the deal now?
So it is the treatment sales tax. It cannot be used for prevention of mental health disorders or substance use disorders as we interpret the statute, the language of the statute in this county. We can use it to prevent justice involvement by meeting people's mental health and substance use needs, or to prevent homelessness, or to prevent other bad things, other bad outcomes people might experience. But we do those things by focusing on actual mental health and substance use disorder
so we
treatment.
can use it for prevention, just not certain categories. Right?
Not the prevention of behavioral health disorders.
Right, and it's got to be, the prevention is because you invested in treatment. The expenditure is on treatment.
Does education fall in there somewhere?
If it's attached to a treatment program that the participant is involved in, education fits as
With
treatment.
in conjunction
It's gotta
with
be
treatment.
part of treatment. It's treatment or a treatment court. Those are your buckets.
And what you recall is correct. It was 2017. And when the board was looking for options to provide provision services to high schools, to youth. And we ended up having a legal opinion stating that that will not be an allowable activity.
And no enforcement either, right?
So that was in about 2017 when the board was exploring those options.
Okay. Clear as mud. Okay, excuse me, go ahead, Carrie.
Okay. Okay, so I think I've covered the large fund balance, but it doesn't necessarily mean the committee is endorsing all of the requests, but is also advancing some additional recommendations. Next up, you've heard from other offices and departments and in many contexts about the Blake decision. The Blake decision does introduce some uncertainty in some TST funded programs. The committee really wanted to put an asterisk next to the funding for a couple of TST funded programs. I will cover that as we go through, saying, hey, we don't know yet what the impact of the Blake decision will be on these programs. There were some members who really wanted to do a one-year budget recommendation, and I said we might all be relieved of our duties if we only provided a one-year recommendation, but we could put an asterisk in recommending a review in a year of specific programs where the committee really felt there might be some impacts of the Blake decision that we would want to take a look at. So I will cover that as we get to those particular programs. And then some kind of more global observations and sentiments from the committee. So TST is currently very heavily invested in services in the justice system and in a lot of connecting people to treatment, coordinating treatment, et cetera. And I think the committee really wanted to look at proposals through this lens of, can we fund actual treatment wherever possible, actual direct services wherever possible, as opposed, and not fund as much sort of coordination, and fund prevention of involvement in the justice system. We know that people with behavioral health disorders are more likely to become involved in the justice system. Can we make investments that meet people's behavioral health needs before that happens, before they're deeply involved in the justice system? So there was that was a theme of the discussions. Another theme of the committee's discussions was diversity, equity, and inclusion, a recognition that BIPOC communities, that people who identify as LGBTQ are often more likely to experience behavioral health challenges, that our systems have not been well designed to meet the needs of diverse populations. And so the committee had a lot of discussion with existing programs about how can we support DEI work, and are there new services that we should be considering? Could TST be a tool in really supporting diversity, equity, and inclusion in this behavioral health realm? And then finally, no budget presentation would be complete without mentioning COVID on the challenges slide. So I took 5 bullets to get to COVID. Probably most people put it as their first bullet, but COVID clearly in this arena as well has created new behavioral health needs, has changed how we deliver services. And so kind of as a broad theme, the need to change our program models. What have we learned? What about telehealth should stick around? What didn't work? All of that. So kind of COVID as a challenge, but also an opportunity to update our program models going forward, and a need to really continue looking at utilization as impacted by COVID. And then my last bullet will be also on every budget presentation I ever do related to TST, which is assessing performance and impact across a wide range of programs. Comparing apples and oranges is an ongoing challenge. That's part of the work that I do with our TST data analyst, and part of the work we ask the advisory committee to do. And it's what makes this interesting, and it's what makes this challenging. So those are kind of some of the broader themes. And then we'll get into kind of individual requests. So the way I formatted the remainder of this presentation goes through each office and department that has requested TST funding. You'll see a slide for each office, or sometimes 2 for some of the larger recipients of TST funding. I've shown at the top of each of these slides In gray, the kind of existing TST funded programs, we don't have a lot of recommendations to change maintenance level, but there are a couple of notes that I want to touch on, and then the policy level proposals. So,
Real quick, Carrie.
yeah,
Can I ask
go ahead.
Robin, how does this and what Carrie's gonna go through correspond to our score sheets and what we need to do there?
So the blue section on her pages correspond to what's on each officer department cheat sheet.
Each officer department though, so,
Right.
so even though Carrie's gonna go through all the different ones, public health are separate than,
Right, and this is a great example. So for Superior Court, on the Superior Court sheet, you should see B0610, which is the request for an FTE. And here you see what the TST recommendation is about that particular item. So you're hearing about them here. And there's not a cheat sheet made for TST in particular. So when we get into the deliberation, the budget team will have a TST worksheet for you. We don't have it right now, but we will. And I'll score high, medium, low on that sheet in accordance with the way you scored them on the other offices and departments that I have.
can we just use the blue sheets like
You
Commissioner
could
Edwards did?
certainly do that and give me those, yes.
You did that for one of the groups.
I did it
He's
for a
done it
couple.
for a few.
And I-
Couple of the complicated ones.
This one really matters, because I mean, some of the sheets we've already turned into you.
True.
And some of
This
them,
is
we'd
the
have to
one.
dig them out group by group
Yeah,
from the binder.
if you
That's,
want to do it on this, I can work with that.
that's, I think, gonna make sense.
Okay.
Okay, sorry, Carrie. Housekeeping on our end.
Right, yeah, no, it is a little confusing because you've heard about these from offices and departments. Now you're hearing from
I
the
think it's
advisory
more than
committee
blue
and
confusing.
They will be on the blue. Those are the policy level requests.
Yeah, right, so we're just hitting the blue.
Yeah.
Although, in the past, the
It had
the
great.
advisory committee had recommended reduced funding for certain things. I don't know if that'll happen this year, but it has happened. And we had to decide whether we would agree with that.
Right. All right. All right.
okay. I will proceed and we'll see if it gets less confusing rather than more. We'll do our best here. Okay, so Superior Court has 3 existing TST funded programs. There is no recommendation to change maintenance level for those programs, but this first program listed is where the advisory committee wanted to put that asterisk. They believe that DUI drug court may see impacts going forward as a result of the Blake decision. The census in drug court is very low right now. We know a lot of that is a result of COVID. The question is whether Blake will impact the ability of all stakeholders to kind of rebuild that census to the level that we're really funding it at. So the committee, I think, would love to look at this in a year and maybe reserve the right to come back with a mid-biennium recommendation if that census is not rebuilt. And I do understand this is a 2-year budget you are adopting, but this is the asterisk. Moving on to the policy level proposals from Superior Court. There are 2 policy level proposals. One, B06-10, Family Recovery Court Manager. This is a request for an FTE created in 2023, no impact in 2022. The advisory committee this is one of the items that the committee is not recommending for funding. Couple of reasons for that. So this position that is contemplated would oversee an existing program, Family Recovery Court, and the next policy request, the Safe Babies Court. Family Recovery Court is funded by TST and has been quite a small program. Safe Babies Court is just getting off the ground and at this point or when we talked about it a month ago, doesn't have participants yet. And I think the committee didn't feel like this additional layer of management was warranted at this time and was a little skeptical that it would be even warranted in 2023. This also goes back to the observation from the committee that they really want to be funding less kind of coordination, management, et cetera. I think it was about this request that one of the committee members said, it's the treatment sales tax, it's not the management sales tax. So a little bit of resistance to funding kind of what feels like more of a management position as opposed to a direct service position. So they were not recommending funding for this one. The
Question?
next policy, go ahead.
Oh, sorry, Commissioner Edwards had a question.
Okay, I mean, I'm maybe jumping ahead. You're saying not recommending funding, but on the Safe Babies Court, you are recommending funding. But I'm just curious, how does that fit into this prevention, education, treatment, enforcement, or intervention? How does it fit in there so we get it right? Because I'll probably be asking that question as we go along.
How does Safe Babies Court?
Yeah, I mean, how,
Within the treatment?
yeah, within the treatment,
requirements?
how does it fit?
It's the treatment court requirement. We can fund treatment and we can fund treatment courts.
I know, okay, Safe Babies, babies don't get
It's
treatment.
a
do they?
treatment court, but the court
Parents.
is about the baby's parents.
And they're sent to treatment, is that
And
what
they're
it is?
in treatment court and there is treatment related to the
Okay.
court, but anything we do in a treatment court is an
Good,
eligible
I'm
cost.
good, I was just trying to figure it out.
Yep, nope, that's,
Commissioner Mejia?
Can I ask a question on, so the 2022, the request, that's what they submitted?
Correct.
Okay, so why is, and the 2022 request for 23,000, that's so low? And we haven't had
Okay,
a
so-
Superior Court presentation yet, so.
Right, yes, I know. I think, so for moving down to Save Babies Court, so that is a program that, and the court will probably tell you more about this, that they are launching with funding from an external grant. That grant is scheduled to end in late 2022, I believe October-ish. And then they're requesting that TST pick up paying for it after the grant ends. So that's why the request in 2022 is so low, because it covers only a couple months of funding, 2 or 3 months of funding in late 2022. And then the request would be for TST to fund the full year in 2023. So this is a new kind of treatment court, a little bit different from family recovery court, but with an emphasis on families with children age 0 to 3. Again, this very therapeutic court model. I think there's a chance that grant could get extended and the TST funding wouldn't be needed, but if the TST funding is needed, the advisory committee is recommending this one for funding. Does that answer your question, Commissioner?
Yes, it does.
Okay. All right. Next up, we have district court. No change recommended to maintenance level funding for mental health court and the the existing probation position.
I have to ask one more question. On this, when you say maintenance level funding to continue it, do we make accommodation of inflation, for an example? Or is it just the exact dollar amount goes across? What's the deal?
maintenance level, I can jump in.
Okay,
Yeah.
Maintenance level, the maintenance level budget means
means inflation.
it means, here's how much money it's going to take to continue to provide services as we currently do for growing. It doesn't include a lot of caseload growth, but some. Inflation, internal service cost adjustments, step increases for staff are in there, medical inflation's in there, postage increases for the assessor, whatever it costs to currently doing what we're doing today is in maintenance level. That's the
And I
way
guess
it's
my
done.
follow-up to that is, we're always informed what we're voting on the new program or the new activity, but we never know what maintenance is and stuff. I mean, is there a reason that it isn't put right in here, maintenance level is?
In each of these You can look at every office
Oh,
and
yeah, but then,
department
I mean-
and see how much maintenance
Well,
level.
well, right, but wouldn't it be so much easier just to have it in there? Maintenance level was 200,000.
It would be easy for you.
Well, yes, and that's kind of what I'm shooting for, is easy for me, but, okay.
We can certainly give you that information.
I don't know that we need it, I just wonder as we go down through here.
Right.
Good enough, just a point of interest. I got it.
So I may be providing too much information because in general, most presentations you're receiving don't even address the maintenance level stuff.
Okay.
Because the advisory committee kind of reviewed everything, including existing programs. I wanted to touch on that here, but
I
in
think
general,
on the baby
your
thing-
budget decisions are really about the change requests and you're
I
not.
like it. Don't let Commissioner
Yes.
Evers talk you out of it. I think it's good. I mean, not that he's trying to. He's trying to add more information. But I don't want to discourage you because I really appreciate that you guys look at the existing funding and sometimes make recommendations, and that's very well taken by me.
And I'm hoping that, like the baby court, the 2023 request, you know, substantially more, but I'd like to make sure that it's working before we put that money into it, if possible, you know.
So that's a great thing to ask Superior Court. I mean, we just heard Carrie say that they currently have no participants.
Yeah, but I mean, if it does start out and it starts working, we should know that. If it doesn't do so good, we should know that too.
Exactly.
So, okay, sorry about those interruptions, Carrie, go ahead.
All right, so district court had two policy level proposals that relate to TST. So their first priority would be to fund an additional intensive supervision probation officer. So this is something TST has funded one position of this type for a couple years now, and they're asking for a second one. The advisory committee wasn't as keen on this request this time around. I think it a little bit goes back to wanting to focus investments on therapeutic clinical services and/or things that keep people out of involvement in the justice system wherever possible. I know the court has found utility to the TST-funded intensive supervision probation officer that they're already allocated, but I think the committee was not wanting to sort of double that investment when there are more therapeutic places that this funding could be placed. So that one was not recommended for funding. The second policy level request from district court is to expand mental health veterans court by adding an additional care coordinator. So they currently, mental health veterans court is basically fully funded by TST. It's a treatment court, so TST puts a lot of support in our treatment courts. There's currently a program manager, I think an admin person, and 2 care coordinators. Mental health district court would like to add an additional care coordinator in 2023. As you can see, the 2022 request is $0. This would be a new position created in 2023. The advisory committee is recommending that, but would like to put some sort of budget proviso, if possible, saying, hey, this position should only be created if the census in the mental health and veterans court requires it. So basically, a year from now, can we look at the census and say, yep, the court is back up to capacity, there's an opportunity for growth, so this position should be created. I think district court agrees with that. If the census is still low, they don't want to add a new position just for the sake of adding a new position. But the recommendation from the committee is if we could formalize that in the budget to say, hey, this position would only be funded if the census is back up to, if the court is full and there's an opportunity to expand, serve more participants, and therefore a need for an additional care coordinator.
Carrie, this maybe is more for Romero, but okay, on the one they did not fund for that position, they're not recommending funding, but if they need that position, Romero, is this something that you've been talking to Mary Ann about that consolidation of need? I know she does pre-trial, and this is post-trial.
The first one?
Yeah, I mean, would that fall within that category, if we put something together with pretrial services that, and we'd have to change the name.
Right.
Pre-post, whatever.
I think requires a larger conversation with pretrial services and how they could be, from my point of view, my humble point of view, how pretrial services can grow, not just to be dedicated just to pretrial, but other areas of supervision involved. And I don't know if this position actually fits within that category. I don't know the description of this position.
I'm not sure, just trying to keep people out of jail.
But certainly there is opportunities, I believe, for pretrial to provide additional services.
Okay, thank you. Go ahead, Carrie, I'm sorry.
All right, moving on. Okay, I think we got a couple easier slides here. Juvenile court has a couple of existing TST funded programs. No recommendations for changes to that and no policy level requests from juvenile court. So that's an easy one. The prosecuting attorney's office receives TST funding to support their work in the treatment courts. The recommendation is not to change that. There is a maintenance level change request. I don't know if that's on your blue sheets or whatever, but that is simply to continue maintenance level funding, and yes to that. There's really no policy level change there. Sheriff's Office, again, continue what is currently in place and no policy level requests. There are a couple of maintenance level change requests, one for COLAs for a contractor and one that's really a technical correction. So recommending approving those maintenance level requests. I put including maintenance level adjustments B11-10 and 11-11. I think the materials you have in front of you might have a typo, 11-10 and 11-10. But it's 11-10 and 11-11. Make sense?
Yes.
All good? Okay. At least one more easy one, public defense, no changes requested and no changes recommended. Pretrial services. So pretrial services receives TST support for its diversion unit. And then there is a policy level request from pretrial services related to the resource hub. You did hear about this from Marianne in her presentation last week. The request is coming from pretrial services. The position would be placed in pretrial services, but it's very much a collaboration. The prosecutor has been very involved in these discussions. Public defense has been involved, as well as a number of other partners. So this resource hub is this concept of a one-stop shop on the courthouse campus in Building 4, where justice impacted individuals could access an array of services. And the request here is for a program manager to make that all happen. So this person would make sure that there are treatment providers who can come on site and provide services through the resource hub, that there are other community partners, so that the one-stop shop really does have all these access to all of these services in place. The recommendation from the advisory committee is a thumbs up on this one, so recommending funding as requested.
Ramiro's got a question or a comment.
Yeah, just a comment to provide the board an update on the tentative improvements for Building 4. We have encountered a delay. And the latest that I got from the project managers is they're going to be done until probably January, all the tentative improvements. So this program will fit along the lines if the board approves the resource hub program manager to start aligning all that. In the meantime, I have asked Leah, and I think Leah's working with Carrie as well as public defense to start working on the many different MOUs that we need to provide the services here at the more than an update.
Okay, keep going, Carrie.
Okay. Okay, so the biggies are public health and social services and the ASO. In your materials, it may be hard to distinguish between change requests that are public health and social services versus public health and social services on behalf of the ASO, but I've tried to separate them on these next few slides. So I'll start with actual public health and social services requests. So PHSS receives TST funding for several things, the kind of administration, community grants, that's my role, Nurse Family Partnership, and a small portion of a veterans case manager. No changes recommended there. There is a maintenance level change request that relates to TST community grants. Yes to that one. That just continues in this past community grant cycle. The board sort of overfunded the community grants to maintain those contractual commitments we made. There's a maintenance level request related to community grants. PHSS also had several policy level requests.
Hold on, I'm sorry.
Yeah.
I have a question on the last slide.
Sure, yep.
Nurse Family Partnership, maybe this might be a Shelley question, but what percentage of that program is being funded through TST?
I do not have that answer readily available, but I can look that up and get back to you shortly here during this presentation.
There are other sources, right? TST.
Oh, yes.
Yeah.
Grants,
Yes.
public health, general fund,
Yeah.
and TST. There's 4 funding streams coming in.
I'd just be curious just to know, you know, if TST wasn't there, what would that do to what, you know, is there?
Well,
Is
we'd
it a
have
quarter?
to-
Is it 10%? Is it?
We'd have to backfill it with general fund because we have a maintenance of
Contracts
effort contract. Yeah, the requirement under the contract for the money we get from the federal program.
Match or something, match type thing.
It's not match, it's a maintenance of effort clause.
Okay.
Okay, well, we can deal with, or I can get that later. Go ahead.
Okay. So policy level request from Public Health and Social Services. So first up, family intervention nurse. You heard about part of this morning in Shelley's presentation. This is one where we were saying, oh, part of it is a technical move, but part of it is a policy level request. So this family intervention nurse was created with some TST funding this year to provide similar services to Nurse Family Partnership, but to families that are not eligible for Nurse Family Partnership. Nurse Family Partnership has a very strict eligibility requirement about enrolling people before 28 weeks of pregnancy, give or take. And this is a little bit more open and could enroll someone later in their pregnancy or after having given birth. We created this with a half FTE nurse. The request here was to expand to a full FTE and this technical correction to charge supervision and support of that position to TST. So this, the numbers Shelley presented to you this morning were lower because the impact on Fund 1500 is less. Here's the impact on Fund 1180 TST. And the recommendation is from the committee is to approve that.
Was that information where you got from Gretchen? Something
Yeah,
about-
half a
9.9
FTE is
or
new.
0.2 from this.
Yeah.
1.2
Yeah.
from
Okay.
that.
Yes,
Okay.
it's this.
But half an FTE costs over $100,000?
No, half an FTE is probably around half of that, but remember, they're also
Moving
taking
the
a
other piece
0.2
over.
FTE that's currently charged to 1,500, moving it here, and then 0.3 of an FTE is coming in. It was bundled.
And I
Yes.
did want to chime in that I do have the answer for you, Commissioner Menzer. It's about TST provides about 20% of the funding for this program and supports 100 families that have co-occurring behavioral health needs for treatment.
God, I can't believe it wouldn't be more than that for that many people, that many families wouldn't have more direct mental issues, and drug issues.
Might be higher, but that's how much the board has approved out of this particular fund.
So we could approve more and
You
put less
could.
pressure on the,
As long as there are those families.
okay.
Okay, so
It would not reduce pressure on the general fund.
No, okay.
Okay, next up, TST support for diversity, equity, and inclusion. This request really came was generated by the advisory committee and advanced by Public Health and Social Services. So a few things to say about this. So the original request as written was for $200,000 a year, no FTEs. I know there was a discussion this morning of various DEI positions. The $200,000 a year was kind of two prongs. So one, what can we do to support and advance DEI goals for existing TST funded programs? So we fund a lot of programs in a lot of offices and departments, impacting a lot of people, a lot of community-based agencies. What can we do with our kind of existing portfolio of programming? So the idea was to set aside some funding for training as well as consultation, organizational assessment, data analysis to really look at that big portfolio of services and how can we advance DEI goals. Then the other prong of that $200,000 a year is, are there new services that we could provide that would better meet the behavioral health needs of diverse populations? So the concept here is issuing a community RFP, a community grant style RFP, but with a laser-like focus on DEI issues. So can we fund evidence-based practices that have been researched and normed for Hispanic populations or for African-American populations? Can we fund services at BIPOC-led organizations? So that was kind of the concept there. So this, again, was requested by the advisory committee, and the advisory committee is endorsing its own request and recommending even more funding there. And this, sort of as the numbers played out, they made a ballpark request, then the revenue projections came in, the other requests came in, and as all the numbers came out and it looked like, wow, there's even more money to invest, the committee feels so strongly about supporting DEI issues that they said, let's invest even more here. So that gray note there is recommend funding at existing level and putting additional funding there on the service side. So for that community RFP, hey, let's look to community-based agencies for innovative models that are really tailored to the needs of diverse populations, putting additional funding there. Questions on that one?
Yep, we got a couple, Commissioner Edwards.
Okay, where does that fit on education, treatment? I guess intervention doesn't count, prevention doesn't count. How does it fit in? And what are you gonna get with it? What's the outcome that you're gonna get? It's almost like, what is there, preventing people from having mental health issues due to life choices or what?
No, so we can't fund preventing people from having mental health issues. So this is acknowledging that there are a lot of people with behavioral health issues whose needs may not be getting met through our existing network of treatment providers. So can we fund services that are tailored to the needs of diverse populations? So it still has to be TST eligible, meaning it still has to be treatment. So it's not prevention, it's not.
Well, isn't it kind of casting a broad net if we don't have a specific to address or a group that came forward with a plan to address something?
But this would be the RFP for those groups to come forward with a plan.
Well, I mean, we'd have to spend $320,000 just to get them to come forward with a
You
plan.
don't have to spend that much, but what the committee is saying, we should invest this much in programs that are shown to be effective with these populations.
Is this kind of to be just
Program.
strictly to be politically correct, or?
I would think not. I mean, I personally know, and data will show, that youth who identify as LGBTQ have a high rate of mental health issues.
Suicides.
A huge suicide rate. So one proposal that might come forward is, I think the organization is Brian's group, provide services specifically tailored to that community to address their mental health issues.
I guess if I had my druthers, I would prefer, like, isn't there a Rosie's House yet over in Lacey? And they give support to those different groups? I'd rather
Maybe
give,
they would come forward with a program
Well-
that's specifically targeted at the BIPOC community
Okay.
or this would have services specifically tailored and shown to be effective for those communities.
is this just our first run at throwing out something to see what we get back? Have we ever
Yeah.
tried that before?
No, we haven't.
Uh,
And this is, I'm speaking up, sorry, I'm taking over here.
No, that's good.
But this is something that I feel quite strongly about, that the county is investing a lot of money in FTEs to start to talk about this and explore it. Here's a proposal where we're actually gonna provide services to the community that address the problem.
Well, like
It's
Thurston,
not the administration.
I'm just gonna say Thurston Youth Services or something. Wouldn't they
They might come
wanna
forward with
provide
something.
that or something? But,
Let's put out an
What-
RFP and see if they do.
well, I'm not against that. I think that's a good idea.
That's
But
exactly what this
I'm
is.
against dedicating money for something that we don't know what the benefits for.
But if we don't go out with if we don't have money earmarked, they have nothing to put on the street to see what we get.
Well,
So, I mean, like any other RFP process, I would then come back to the board and say,
And say. here's
I've
what
drafted
we
an
got
RFP,
oh,
may I
okay, so
release
here's some money
this?
set
And then,
aside, almost like we did
For
for,
the community
climate,
grants.
climate thing. Didn't we set some money aside to do something? Is that what you're saying?
Well, in the community grants for the TST,
Yeah.
we get a sheet back with scores, and then, I guess in theory, we
Right.
could say, we don't wanna fund any of these things. We don't think they're gonna create enough benefit.
It's the same.
Exactly.
For the money we're
It's
being
the same,
proposed.
it's, although there is a different program, well-needed program, it's the same process that you have utilized in any request for proposals. Request for proposals, you get proposals, there is a subcommittee who reviews those proposals and provide recommendations to the board, whether you like to grant those proposals with this money. So there's always that check and balance. At that point, you will
Oh, yeah.
probably, the board may make a decision, I don't think it meets the criteria or whatever, and you have the latitude to do
Okay,
it.
so you just want to dedicate some fund to that as seed money. Okay.
Commissioner Ian.
But who, go ahead. I was gonna ask, who would be evaluating whether or not
Yeah.
what gets proposed is going to be effective?
Well, why
Who
would the
will be
TST group?
evaluating?
How about the TST group? They're not,
I don't think,
one?
with all due respect, they look very diverse, non-diverse, if you will.
On-diverse? Yeah, I think they're a pretty
I
diverse
don't see a
group.
lot of diversity on my street.
You're kidding. I think that's a pretty diverse group we have.
we don't have
Well,
the full
I think
committee here
definition of
today.
diverse is a little bit different.
Really? Okay.
Okay,
well,
do we need more
Commissioner Mejia.
information on this
Commissioner
one?
Mejia has a
Or-
question, and we'll just see where we go.
My question is, you said in regards, like, half of it was going to be for training. I mean, training
So-
for who specifically? Is it gonna be for those TST people? Is it gonna be for, the sheriff's office, the Superior Court, District Court? Training for.
Okay, so, yeah, so it wasn't, it was within this pot of money, 50,000 per year for existing TST funded programs, which could be, so the idea is that the money would be central in the public health and social services budget for all existing TST funded programs to access. And I would have discussions with those programs. So yes, with the courts, with the sheriff's office, with even community agencies receiving TST funding. Okay, how, and not just for training, but also kind of for consultation, saying, hey, maybe we need I'm just going to use an example. I'm not trying to single out a program. Maybe it would be useful to have a consultant with some expertise in treatment courts, as well as some DEI expertise, come in and look at our policies for how we refer to and select people for entry into treatment court to see if we are having unintended bias in that process. Maybe it's something like that. So I actually am scheduled, we'll see whether we have funding available to this, depending on the decisions you all make, but scheduled to have a brainstorming conversation tomorrow with the TST executive team, which is the group of offices and departments that receive this funding, about where do they see the needs? Where do they see, what type of assistance would they want having this? Recognizing that we have a big portfolio of TST funded programs that are at very different places in sort of how they think about DEI issues. So that's the concept. I have been talking to Nicole Miller about that. She's coming to my meeting tomorrow, which at this point is simply a brainstorming session. So it could be accessed by all TST funded programs is the concept.
I have to say, I'm not thrilled about buying something I don't know what I'm getting.
Okay, I think we understand it. We can think about it and talk about it more. So let's keep going.
Okay, next policy level request. So law enforcement assisted diversion, LEAD. You have heard much about this project. LEAD is currently funded by a grant or a contract from the Healthcare Authority, and TST is providing some match funding. That funding is that external funding is secure through June of 2022. Beyond that, I think it's uncertain. So we were asked to build in a request for TST picking up full funding after June of 2022. So these numbers reflect kind of the first half of 2022. TST would just be the match. The remainder of the biennium, TST would pick up the full cost of law enforcement assisted diversion. The advisory committee is recommending that for funding, but did want to put the asterisks, I guess, for two reasons this time. One, assessing the impact of Blake on the LEAD model. And two, of course, if other funding is available, it would, and if the TST is not needed, it would be nice to have an opportunity to amend the budget accordingly. Questions on that one? I know I still have quite a bit to get through and it's 2:30.
I have questions.
Okay.
Whether it's going to continue to be a viable program, understanding Blake kind of gets in the way, and how the response of that limited response on law enforcement to those individuals in crisis, if that's going to cut down on the caseload. And we talked about that at our BHO meeting a bit. So I'm just wondering about it, that's all.
So is the committee, which is why they're recommending that a year from now,
That
just
they
take a
review.
look. Yeah.
Yeah,
And
that's how
see
come
what
I
happens.
recommended only an annual budget.
We can review it in a midterm.
Okay, well, I'm okay with that. I think we do need to review.
Yep.
Okay.
Okay, last policy level request directly from PHSS. It's classified as a social service specialist, but the concept is a community health worker. This was not recommended for funding by the TST Advisory Committee. The concerns here were a couple. So one, going back to that, I think the committee is growing a little weary of funding connections to treatment rather than actual treatment and actual kind of direct service recovery support services. Some questions about whether this role could be filled by a peer at a licensed behavioral health agency for a lesser cost, and kind of concern about the overall cost. So this one was not recommended for funding by the TST Advisory Committee. All right, moving on. The ASO. So these, the ASO, as I said, quite a bit of funding passes through Public Health and Social Services via an interlocal agreement to the ASO. In terms of maintenance level, existing programs, there are a couple of tweaks recommended here. So that first chunk of programs you see on the slide, no changes recommended. Then when you get down to WISE, there is a recommendation here. WISE is a very intensive treatment program for youth with really the highest levels of need. TST has funded WISE slots for youth who are not eligible for Medicaid for years, and there has always been a waiting list for those slots. So this again came down to, okay, we saw how much revenue we had, we saw how much money was still available, and the committee said, hey, even though this wasn't requested, there's not a change request for this, let's put a bit of additional money here to fund some additional WISE slots for non-Medicaid youth, thinking that this could have impact for youth with the highest needs.
Okay, so that's a good example of, okay, maybe we're for the 80,000, I don't know. But what are we putting in there now?
450,000-ish. Not exactly, but I can get you that number exactly, but ballpark.
It gives us an idea, I think.
Ballpark.
So they're asking that the committee is asking that we boost this rather than just do maintenance funding.
Correct. Yep.
Hold on.
Okay.
Hey, Carrie, I just have a question there. Since the ASO did not request additional funding for this program, how was concluded there is a need for additional money?
So really because of that waiting list. So, I mean, after these revenue projections came in and I said, wow, we have, I had been telling people all along, TST has a healthy fund balance. There will be funding for additional new programming, but there probably won't be funding for everything requested. Then as the revenue projections became more and more clear, we were like, wow, there's funding for everything requested and funding for more. So I started having conversations with the advisory committee, with different program partners. We get reports every quarter from all of our programs. So I was thinking about, okay, what are the programs where we have waiting lists? And this was one that jumped out at me, knowing that there has always been a waiting list for these.
Okay, I want to piggyback on top of Romero. Who didn't get served?
Because there's a waiting list in this program?
Yeah, I mean, what was the need? I mean, okay, they're saying 80,000 maybe, but who didn't get services because we didn't adequately fund it?
So youth who are not eligible, youth who are not eligible for Medicaid. Last I knew, there were about 13 youth on the waiting list. That's a little bit higher than usual. The average is usually about 5 to 7 non-Medicaid youth on the waiting list. And so they may be receiving some sort of crisis services. If they're on private insurance, they may be receiving not much. And sometimes kids deteriorate to a point that they need inpatient services, and then they can finally qualify for Medicaid.
Would 80,000 clear the backlog?
80,000 it's a very expensive service. So no, it wouldn't clear the full backlog. It provides 2 more slots. It's $40,000 a year.
More than that. Okay.
So the board could choose to put more than that in, probably up to, so it's about $40,000 per year per slot. That's not a number we make up locally. That's a actuarially derived rate. A state actuary makes up that rate, derives that rate. And that's what Medicaid pays for it. So $40,000 per kid per year. And the average waiting list is about, as I said, 5 to 7. So we could put more into that to truly clear that backlog. Can I move to the next row?
Yes, please.
Okay. So existing TST funded programs, Steps to Wellness. This provides brief intervention, brief clinical services at Rosie's Place, the young adult shelter operated by Community Youth Services. The recommendation in consultation with the provider and the ASO is to actually not fund that program in 2022, to zero that out. So it's funded at $135,000 a year, to zero that out, pause that funding for 1 year, restore it in 2023. The provider is in agreement with that. There's a couple reasons. Rosie's has been largely closed during COVID or not operating as it typically does. This really was a program designed for a particular type of milieu that is not existing in the COVID era. And they have had huge staffing challenges. So the provider said, we like the idea of pausing this for a year and relaunching with perhaps some modification in program model in 2023.
What kind of money are we talking about there?
$135,000 that we would zero out in 2022, restore in 2023. Okay, there's numerous policy level requests from the ASO. All of these are being recommended for funding by the advisory committee. One thing I would note, I've shown these all as 0 FTE. They are 0 county FTEs. That doesn't mean there's not FTEs on the ASO side or the Olympic Health and Recovery Services side, but they are 0 FTEs from the county perspective. I will try to summarize these really quickly. First is some non-Medicaid slots for intensive treatment for transition age youth, that 18 to 24-year-old population. That's recommended for funding. Scattered site pilot program peer outreach. These are peers who would work with I believe you've heard about the scattered site pilot program through the Office of Housing and Homeless Prevention. So the ASO worked with Keeley on this request. This would fund 2 peers to embed in those scattered site pilot teams. This just quickly shows the power of Medicaid. We can buy 2 peers for $63,000 with local funds because they can draw down Medicaid for the balance of those positions. Expansion of Children's Mobile Crisis Services. So Children's Mobile Crisis Services are available to Medicaid youth for up to 60 days, currently available to non-Medicaid youth only for 72 hours. This request would bring non-Medicaid level of service in line with Medicaid. TST increases for funded treatment programs. This probably could have been classified as maintenance level. This is basically COLAs for some funding that runs through the ASO to providers that haven't gotten COLAs in 8 or 10 years. So definitely a priority for funding. Next one is actually a decrease. You don't see that all day, every day. The ASO, TST currently funds through the ASO a jail behavioral health program. So mental health services in the jail, mental health professionals, and a jail transition peer. The ASO has learned that they will be receiving state funds for a jail transition peer. They can charge this peer to those state funds and give back the TST funds. So recommended for funding, which is actually a decrease. And then the final one on this page.
Carrie, sorry, is that part of the True Blood grant?
No. In short, no. The new funding they're receiving is a different fund source, and I can get details on that for you, but it's not True Blood.
So it's outside of the True Blood grant.
Yes. Last row on this page, I believe Joe Avalos spoke to the Board of Health on this issue yesterday. This is a little bit of a response to House Bill 1310. So the ASO has worked with Lacey Police Department a couple months ago, launched they're calling it mobile outreach with Lacey. So 2 crisis services clinicians and 2 peers embedded with Lacey Police Department. This would basically replicate that with our sheriff's office. We do have a letter of support from the sheriff's office. They are very excited about this. Again, the power of Medicaid here. So the request is for $176,000, but it would fund 4 positions because they'd be drawing down the remainder from Medicaid for, again, 2 crisis services clinicians and 2 peers. So all of that recommended for funding as requested. Last but not least, so after running all the numbers on everything I just talked about, there is still room in the fund to fund more services. And that amount of money is about $500,000 a year. So the committee said, hey, what would we do that could have the most impact on this population for about $500,000 a year. We talked about a number of different ideas, and I think the committee felt that every single conversation they have with everybody always comes back to housing. TST has some funding that we use for rental assistance. There are a lot of other funders funding rental assistance, and I think most people working to place this population would say having rental assistance isn't enough. There simply are not beds. There's no place to put people. So this recommendation is big and bold and is kind of a brave new frontier for TST, but TST has never funded capital acquisition, construction, kind of the brick and mortar of beds for housing. I had some conversation with Robin. I've had some conversation with Elizabeth Petrich. We believe this is allowable if we cross all the T's and dot all the I's. Other counties do use their 0.1% to fund capital costs of housing. So the recommendation here is to put $500,000 in each year into housing. In the first year, there's a specific project identified. So Ramiro just asked about Trueblood. So a component of the ASO's Trueblood work, they have a new grant to acquire single-family homes, 2 in Thurston County, 1 in Mason County, to place members of the Trueblood class. With additional funding from TST, they could acquire 3 single-family homes rather than 2 single-family homes in Thurston County. We wouldn't necessarily be limited to the strict Trueblood class, but could be other individuals with very significant behavioral health concerns, maybe step downs from Western State Hospital, et cetera. And so the recommendation is to kind of augment that grant with some TST funding. And then a little bit of a to be determined recommendation for 2023 could be augmenting that project further, or could be working with Healy, Tom, et cetera, and you all to identify another project that with an infusion of TST funding could house more people with behavioral health needs. And it's 2:44 and I'm done.
Not quite.
I'm done from my perspective.
I appreciate your attempt to blaze through the last bit to get to your time, but I have a lot of questions on the TMBH, ASO, those last 6, and I think Ramiro's hand was up as well. So I'll go.
Sorry, okay.
The county manager.
So a particular question on priority 49, the B4002.
Mm-hmm.
Where is that? The
TCSO bottom one.
The bottom one?
Yep.
And wouldn't that be related to LEAD?
Related, but different. So this is more, we had a whole innovative justice meeting about this a month ago. Let's see if I can articulate. So this is more a co-responder model for in the moment crisis services, as opposed to LEAD, which is more that kind of harm reduction, ongoing, longer term case management engagement model. So kind of the in the moment crisis, and again, a little bit responding to some, but not all of the issues posed by House Bill 1310. So, call comes in looking for a law enforcement response, and there might be this co-responder model might put another tool in the toolbox for sheriff's office response on those types of calls.
Sure sounds
So
like that we thought LEAD was.
Sounds like LEAD to me, and in fact, LEAD also is gonna be evolving in response to 1310. So I'll be curious, because based on the description, sounds the same and smells the same, so.
I think I was at the same meeting as Carrie. I think I understand the distinction. I had a different question that's related, but this is like dealing with that situation in the first instance. LEAD is about, okay, okay, now we've got the situation calmed down. What are we doing with this person long-term? Am I arresting him? Am I calling in a case manager to work with this person over a period of weeks? Like, that's what LEAD's about, is that let's not take him to jail. Let's connect him with this case manager and go on a different track down the road. This is a person almost like Olympia's crew unit or whatever that would be like, we don't even know what's going on. We're just going out and we think mental health's involved. Let's de-escalate. Let's have the expertise that maybe law enforcement doesn't have. My question about it is does this, and I asked Joe Avalos this a month or two ago, and he didn't have an answer at that time. I don't know if there's been greater clarity. Does putting these types of professionals in the sheriff's office then subject them to the law enforcement limitations that everybody's concerned about versus having them be housed externally and then sheriff can call them to respond and they're not subject to the limits that law enforcement, like, are they considered law enforcement now, like quasi-police officers because they're embedded within TCSO? Or do they have a different status because they're mental health professionals? And it doesn't matter I want the sheriff's office to have this tool. I want to structure it in a way that's most powerful and least limiting for their use of the tool, if that makes sense. Is my question making sense, Carrie?
Yeah, although I wouldn't think they would, I mean, they wouldn't be sheriff's office employees,
They
they
wouldn't have a
wouldn't be
commission.
commissioned
They would have no commission.
officers.
So
I don't see why they would be but I mean, if Joe didn't have an answer, I don't have a better answer than Joe, but I would be surprised if they would be subject to, they're just not law enforcement. They're not commissioned officers. They're not sheriff's office employees. They'd be OHRS employees
So you're saying that
partnering closely with the sheriff's office, but
okay, they would be OHRS employees, not
Yes.
sheriff's employees funded by TST.
correct, they would be
That's why it's on this
OHRS
page.
employees.
Okay, yeah,
Yes.
because I mean,
So-
I didn't want a situation where, because I know in some places like, I think Kitsap County, they have social workers and stuff embedded as employees. Now, they're not commissioned or whatever, but now that these new laws come in, if the sheriff gets a call and says, I can't respond to this because of 1310 or whatever, so I'm not hearing that a crime is being committed. I'm just hearing that someone's about to commit suicide, as Mark Friedman gave a hypothetical yesterday. I want this person, wherever they're to be able to go there. Like, that's the point, you know? If the sheriff can't go there, at least for now, and I absolutely believe this will be fixed in the next, legislative session, but let's just say it's not. If the sheriff can't go there, I certainly don't want these people not to be able to go there because their office is in the sheriff's office, or whatever. You know what I'm saying? I don't want them to get caught under this umbrella of law enforcement response because of how we've structured the funding and their job title or who's their supervisor or whatever. And I don't know that not having a commission solves that. I don't know the answer to that. And I don't think I've heard a definitive answer to that. But anyway, that's a question there.
Okay,
Going up the chain, let's see, I'm gonna just go backwards. I'm okay with the next two. Expansion of children's mobile crisis services. I just didn't quite understand what this is. Or who's children's mobile crisis? So you mean a child in a mental health crisis has a specialized responder so that who potentially has
Correct,
expertise
yes.
to deal with a child in a mental health crisis?
yep,
Okay,
exactly. So
Okay,
it's 24/7 response. The provider is Catholic Community Services. It used to be only available to Medicaid youth. A couple of years ago, we added TST funding to make it partly available to non-Medicaid youth, but this would bring kind of the same level and duration of service that Medicaid youth get.
okay, and then going up to the next one, scattered site program. I thought that this program was a maximum. It was started out as 6 months, and then we expanded it to a year. So why are we doing 2 years of funding for this program if the board hasn't authorized the 2023?
So is that for 2022 or 2023?
It says both.
For both years?
No, that dollar amount with each year, it looks
Each
like to
year?
me.
Because that's a very good question.
That is a good question. I did not know that the pilot had only been authorized through 2022. I can follow up with, I guess,
Yeah,
Keely.
I mean, not only has it only been authorized, but we're in the midst of a massive, partnership with City Olympia to acquire property and basically create a completely different structure for what that program is designed to accomplish. So it's not just like, oh, well, technically we haven't done it. We actually have a plan to do something completely.
To not do it.
Yeah, to
Okay.
not do it. So
Right.
I'd say that would have to be a 1-year request only.
Okay.
And then the first one, again, this is more just like the third one. I just want to make sure I understand what this is doing. Can you just talk a little bit more about it? Just, you were going fast for me.
Yeah, sorry. So this is treatment slots for, so it's a little bit similar to what we just talked about with WISE, but so Community Youth Services has a WISE type program specifically for this transition aged youth population, this 18 to 24, 18 to 25 year old population. It's intensive treatment with a range of supports, and so it would fund some non-Medicaid slots for that population.
Anybody? Okay. I'm sorry, I took a lot of, yeah, go ahead, Ramiro.
Carrie, is this related to the housing acquisition and capital? I think the
Yes.
2022, 500,000, I think you have a little more defined as to what that is. The question that I have on that is this is the seed money or this is the last dollar to complete a project?
So for the project we're talking about in 2022. So again, so the ASO, and I think Joe might have spoken to this briefly yesterday, they've recently received $1.15 million from I believe it's through the Seattle Foundation, True Blood funds, which would facilitate the purchase of 2 Thurston County homes, 1 Mason County home. So single family homes in which they would place True Blood class members and then use various other sources of funding to support people in those homes. This would allow them to buy an additional home.
Oh, okay, that makes sense. So this is actually tangible that you can accomplish in 2022. But in 2023, setting aside $500,000 without having a project in mind, that sounds interesting.
I got a project we could attach to that. We buy people in need that fall within the criteria of needing help, a one-way ticket to their home destination where they have support. A support mechanism in place. Their family is from Kansas. We'll offer them to buy a ticket back to Kansas where they can get some help from somebody that loves them. We got a lot of unclaimed bodies at the coroner's office. We've got to do something about it. Okay,
Anybody
that's
else
my 2
before we
cents.
take a break? Commissioner Mejia, you good? Yep. Thank you, Carrie. We'll take a break. We've got let's take maybe 7 or 8 minutes here and we'll pick up with emergency management and medic 1, maybe 5 after 3.
Yep. Thank you.
Thank you.
Are live, Commissioner.
Okay, we are back, 3:08 p.m. We're picking up with our second segment of this afternoon's budget work session, emergency management, the Medic One. Kurt Harden's here, Director of Emergency Management. We have 45 minutes, Kurt, thereabouts, to go through your items, so turning it right to you.
Okay, thank you, Commissioners. Let me, first of all, I want to be able to share my screen. So hopefully you should see the Emergency Services budget presentation on your screen.
Yes.
Okay, great. So thank you, Commissioners. Good afternoon, Kurt Harden, Director of Emergency Services. And with me is Joy Miller. She's the Fiscal Manager for the department. And what we're going to do here is present the 2022 and 2023 budget. The emergency services budget's broken down into two divisions, Medic One and Emergency Management. Each division has a completely different funding mechanism. Medic One relies on a property tax levy, and Emergency Management is funded by the general fund and federal grants. Here's the mission statements for both Medic One and Emergency Management.
Hello?
Okay.
Kurt? Sorry, you just froze and like, we missed that entire, whatever you said about that last slide.
Oh, okay.
Oh, you just
So-
left it there for us to read?
Yeah, well, it was there for you to read, and it was just the mission statements and overview for
Okay.
Medic One and Emergency Management.
It felt like it was like, like the computer
Okay.
froze. Okay, go ahead.
Oh, okay. So here, the proposed 2022 department budget is $18,789,994 with a proposed 21.5 FTEs. And for 2023, it's $20,182,201 with the same number of FTEs. Emergency Services, I will tell you right now, is facing a retirement tsunami over the next 2 years. 1/3 of the department staff have indicated plans to me to depart, mostly through retirements and one through a relocation because they're moving out of the area. So this type of turnover is going to have a severe impact on the department, especially since we are one deep at most positions. We'll begin with Medic One. And Medic One is a critical partner in Thurston County EMS providing pre-hospital services. Thurston County EMS partners include the 12 fire agencies, 2 hospitals, and 2 private ambulance companies. The Emergency Medical Services Council, the advisory body that oversees EMS in Thurston County, worked with Medic One staff to develop 2 budgets, and based on the Medic One levy vote in August, recommended that the Board of County Commissioners adopt this proposed budget for 2022 and 2023. The Medic One budget in the past 10 years has been conservative when expenditures started exceeding revenue. EMS costs have increased an average of 5% over the past 10 years, while revenue increased an average of 2.46%. These significant areas of the budget in Medic One were deferred and or delayed in order to maintain the fund balance over the last 10 years. The 2020 and 2021 budgets that you see in front of you are an example of this. Expenditures remain relatively flat because of this conservative approach over the past 10 years. To address some of these shortfalls from the past 10 years, we're proposing 10 policy level requests, which includes some additional FTEs. The 2022 and 2023 budget proposals are sustainable based on projected revenue, which is reflected in the 10-year county plan. Here's a snapshot of the Medic One budget broken down for 2022 and 2023. I'm going to go through some of the acronyms here. ALS is Advanced Life Support, and essentially that's the program to support paramedics. Basic Life Support, or BLS, is our program that supports EMTs, but also our CPR training for the public. And then we have the administrative portion, data support, ER&R, and then operational transfer. At least, as you'll notice, at least 70% of the funding goes to support the ALS program or Advanced Life Support program, but that is typically historical of previous Medic One budgets. And the operational transfer is a normal process for the Medic One operating and reserve funds. So the challenges facing Medic One over the next biennium are the national healthcare costs, which are a leading driver for EMS and Medic One costs, and that's risen 5% annually over the past 10 years, and it's projected to increase by 5.3% for the rest of this decade. Determining the future EMS infrastructure for the next 20 years is difficult, but it's necessary in order to lay out a path for success in Thurston County. Providing services in Thurston County through EMS in a pandemic has been challenging. Assumptions made for EMS response can be quickly overwhelmed, and the ability to pivot towards new emergency medical practices is critical. And then the last one, replacing and fielding new medical equipment is complex. Typically, new equipment requires training and implementation while the old equipment is in use. EMS cannot stand down to replace aging equipment, but must continue to do their mission. So the forces that are driving Medic One costs, healthcare costs, have already discussed that. EMS 911 calls have increased 36% from 2008 to 2020. As of June 30th, 2021, the 911 EMS calls were on a pace this year to hit just over 36,000. Then in July and August, call volume jumped another 11%, and now we're projecting to go over 37,000 calls in 2021. This additional EMS call volume was not available prior to budget submission and is not factored into any of our 2022 or 2023 budget proposals because we didn't receive this information until after August 15th. Thurston County population continues to increase and is changing, and is a changing demographic. The population increased 21% since 2008 and continues to grow. As we get older, we have more ailments that need medical attention. And then paramedic disability costs have exploded over the past 3 years and increased 250%. In 2019, the disability costs were $290,000. In 2020, there were $558,000. And in 2021, there are currently $525,000, but they're expected to exceed $770,000 by the end of this year. Only a small portion of these disability costs can be tied directly to COVID, but the increased operations tempo and mandatory overtime is wearing down the workforce. Disability increase is probably the biggest surprise outside of direct COVID expenditures that we've experienced this year. ALS contracts require Medic One to pay 80% of disability costs and the backfill. And then IT costs have jumped 30 to 40%, and they were unanticipated in 2021 as well. And then the last one is support the fire agencies for cost of living, medical equipment, and training to maintain EMS credentials has continued to increase. And I want to go back to the 911 call volume. The jump of nearly 12% in July and 12% in August over previous year is a concern, but we're hoping that that's just an anomaly, and we're waiting to see how that pans out for the rest of the fiscal year. So our first priority, one, request to add a quality improvement coordinator. So in 2005 to 2008, Medic One participated in a cohort study on cardiac arrest outcomes. In 2009, the results of the study were incorporated into a countywide implementation of cardiac arrest response in Thurston County. The average cardiac arrest survival rate in 2005 to 2008 was 22%. And after implementation of the revised cardiac arrest response and training across the entire EMS personnel in Thurston County, that survival rate increased to an average of 46% from 2009 to 2012. This position is needed to continue the cardiac arrest review process, which began in 2008 and directly led to increased cardiac survival rates. Additionally, this position will apply a similar process to sepsis, trauma, stroke, and respiratory patients to achieve improved hospital outcomes and quality of life. The cardiac arrest review requires assessing every cardiac arrest response in the county. This previously was completed by extra help who are trained paramedics and or EMTs, but the ability to maintain this quality control with extra help has degraded due to increasing demands on the EMS workforce, increasing call volume, resignation of part-time staff, and difficulty in part-time staff replacement, and also the current pandemic. This position will continue the cardiac review process to maintain the high cardiac arrest survival outcome. The full-time position also incorporates quality improvement process for sepsis, trauma, stroke, and respiratory patients, striving for the same improved patient outcomes that we saw in the cardiac arrest. So the outcome of this, filling this policy level request is continued increased cardiac arrest survival rate and increased sepsis, trauma, stroke, and respiratory patient outcomes, along with Medic One ability to determine protocol changes to reflect these areas. Current Medic One staff have a full workload and do not have the bandwidth to assume these duties. The second request is to add an advanced life support training coordinator. This position is needed to implement and sustain an advanced life support ongoing training and evaluation program. Medic One currently utilizes an advanced life support continuing medical education program for recertification of paramedics. Washington State Department of Health requires all paramedics to complete annual training to maintain their credentials. Thurston County is the last county in the state to utilize the continuing medical education process for paramedic certification. The paramedics in Thurston County have expressed a desire to switch to the ongoing training and evaluation program to align themselves with the rest of the paramedics in the state. The proposed ongoing training and evaluation program process is acknowledged as an improvement over the current continuing medical education process, and it also standardizes paramedic credentialing and ensures each paramedic receives the same level of training. Outcomes for this are training will be aligned with the rest of the state. It also ensures best practices. Improved training for the paramedics equals improved patient outcome, and it will improve paramedic credentialing process. And once again, current Medic One staff have a full workload and do not have the bandwidth to assume these duties.
Can I ask a question about that?
Yes.
Currently, where are they getting this training at? And is there like a backlog on that training?
What they're doing currently is using the continuing medical education. So the paramedics go out and select various continuing medical education conferences, certifications, and then they select those that are already pre-approved, and then they turn around and we pay for them to attend that training. The challenge with that is they're not all getting the same level of training. One may select a conference on airway management, while another one may select a conference on sepsis. And so they're getting mixed matched training. And this ongoing training and evaluation program, which again, the rest of the state has already gone to, and we're the last ones, would standardize the training, the credentialing for the paramedics in Thurston County.
Ramiro.
So maybe along the same lines, what is the, and I'm going to get to my question. I see the proposed revenues is 16 million.
Pardon me, I didn't hear the question, Ramiro.
So on your proposed revenues related to Medic One, the 1290, the operating,
Okay.
is that's 16,083,000 or thereabouts. So, and then the proposed expenditures is 16,470,000. So right off the bat with the new funding, we'll start eating into the ending fund balance. And yet we're requesting 3 new positions.
Correct, but also this is sustainable because in the year after, in 2023, the levy rate goes up from 35 cents per thousand to 38 cents per thousand approximately. And so when that goes up, we run the numbers, and in the 10-year fiscal plan, we show that this is sustainable. And then eventually in 2027, the Medic One levy rate goes up to the 50 cents per thousand. What this does is we use the stair-step approach to request the funding that was necessary to meet the ongoing budget requests that we anticipated for the next 6 years.
Somebody already went over this.
Did that answer your question, Ramiro?
I think so.
Okay.
Okay, yeah, go ahead, Kurt. I think we're up to number 3. No,
Yeah.
number 2.
Number 3, priority 3, okay, which is slide 10. Okay, this next one is a request to add a basic life support, a senior EMS instructor. So state law requires senior EMS instructor to conduct every EMT initial training course. Thurston County currently conducts 2 EMT training courses a year, which is not enough to meet the current demand for EMTs in Thurston County. Currently, the senior EMS instructors are staffed with extra help who are EMS credentialed and work full-time in fire agencies. The time commitment for each EMT course before COVID-19 was approximately 400 hours, and now that has increased due to mitigation measures in multiple sites for the classes. The number of credentialed SCIs has dropped from 6 to 3 over the past 2 years. The remaining senior EMS instructors indicate that the continued operations tempo at their fire agency and supporting the EMT initial training program is not sustainable. Fire agencies have stated they need additional EMTs beyond the 2 courses run by Medic One each year. Medic One uses extra help for the EMS instructor and evaluator requirements. This pool of instructors and evaluators has been diminishing over the past 2 years. In addition to being in charge of the initial EMT training courses, this position will assume responsibility to recruit, train, and retain the pool of instructors and evaluators. The outcome for this position will be increased EMT credentialing to support fire agency needs, improve patient outcomes, and it supports increasing instructor and evaluator personnel. And once again, the current Medic One staff have a full workload and do not have the bandwidth to assume these duties.
Commissioner Mejia.
Kurt, what's the difference between number 2 and number 3?
Number 2 is ALS, which is paramedics. So what they're doing is coordinating the paramedic ongoing training and evaluation program. And so they're coordinating that for the 70 paramedics within the EMS structure here in Thurston County. Number 3 is for the EMTs, emergency medical technicians. And that takes care of the EMT initial training courses and then also trains, recruits, and retains the instructors and evaluators that are necessary for the EMT initial training and the ongoing training and evaluation program for EMTs. And they're separate. One's ALS and paramedics, and one's EMTs and basic life support.
And you need a full-time person for each of those activities.
Correct. Because right now for the senior EMS instructor, that position is being was maintained by 6 part-time personnel, but the number of hours for each course has gone up. The demands for the number of courses have gone up, and we are going from 6 to 2 SCIs as part of our part-time cadre. And the 2 that we have are indicating to us that is a challenge for them with the current op tempo with the fire agency to be able to sustain their participation in the SCI program. For the ALS ongoing training evaluation program, we have documentation where OTEP programs, other similar OTEP programs require a full-time coordinator to manage that program. And that's going to be a new program. It's currently we don't have any program like that. Like I said, it's a continuing medical education process.
So number 2 is a coordinator and number 3 is actually the trainer. Is that?
It's a senior EMS instructor, correct, 4 EMTs and 4 BLS.
Number 1 is the number 2.
And
Okay.
right,
Okay.
and okay. Other questions on priority 3?
Nope, head on up to number 4.
Okay. Okay, priority 4, which we should be on slide 11. The medical data support has become more complex over the years. I'll tell you that every medical device has a data component, and it's also synchronized into an interdependent system. Since most of the changes are increased costs, I'm going to just touch on the overtime and extra help, the maintenance and operations, the communications piece, and the repairs and maintenance for fire agencies. But I'll answer obviously any questions that you have on the other areas of this policy level request. We're requesting $30,000 for overtime and extra help. The EMS data support requires a 24/7 response capability to address outages and other issues within Thurston County. There are approximately 170 EMS response apparatus in Thurston County that Medic One is responsible to support. Previously, there was only one person, overtime exempt, who was on call 24/7 to respond to after-hours data emergencies. Medic One's requesting the funding to place a salaried staff position on call 50% of the time. This improves the quality of life for that overtime exempt person and helps with the retention. Also, the overtime and extra help are used to implement new and/or replacement equipment fielding in 2022 and 2023 for the 170 EMS response vehicles. The $13,000 we're requesting for maintenance operations funding is needed for data staff to maintain their cyber proficiency, for staff computer parts, for the equipment replacement within the admin vehicles, and supplies for new staff, and also miscellaneous costs. And then the $37,100 for communications is an increased support for ALS, Advanced Life Support, and BLS, Basic Life Support communication devices in the EMS response units. Those include cell phones, those include but are not limited to cell phones, modems, Wi-Fi, et cetera. And then the $91,349 for repairs and maintenance and support of fire agency medic unit equipment are costs for the maintenance facility that we contract with to service and maintain the communications equipment. And again, the outcome here is to maintain medical IT services for the 170 response units across the county for patient care.
Great, sir.
Yeah.
Hey, Kurt.
Yes, sir.
On the 37,100 for communications, how that relates to the 911 upgrade of the equipment that we're going through?
This is not related to the upgrade of that equipment. The fire agencies themselves are part of doing that equipment upgrade themselves. This one is just for the EMS support for those response units. And again, it's Wi-Fi, it's the cell phones, it's the modems, it's what goes into our patient charting software. And then from that patient charting software, it goes in and gets translated from a modem into Wi-Fi, then gets translated and pushed out over to the hospital. And we have, again, 170 response units that we support. So this is not associated with that 911 upgrade. Did I answer your question, sir?
Yes, sir.
Okay. Okay, slide 12, policy level 5, basic life support, financial support to fire agencies. Medic One provides basic life support funding to the 12 fire agencies for medical service costs. This is equipment, pharmaceuticals, and expendable supplies. These costs increased an average of 5% a year over the past 10 years and are expected to increase 5.3% a year through 2029. Funding for these supplies has not been adjusted since 2015. Priority 6, the Advanced Life Support Agency Contract Support. Medic One contracts for Advanced Life Support Services, which is paramedic services with Lacey Fire District 3, Olympia Fire Department, and Tumwater Fire Department. These contracts provide for the 911 provided paramedic services in Thurston County and the 7 primary and 6 reserve medic units. The contract increases incorporate the increased labor costs for the 3 fire agencies. Also, as noted previously, disability costs have increased 250% over the past 3 years. Medic One is contractually responsible to fund the disability costs and backfill for the paramedic position. The outcome here is designed to retain paramedics in the workforce and recruit for vacancies.
Questions on this?
Who are the contracts with?
Yes?
Who are the contracts with?
Contracts are with Olympia Fire Department, Lacey Fire District 3, and Tumwater Fire Department.
Fire departments, okay. Thank you.
Okay.
You said, so you said in the earlier slide, paramedic disability costs, and that's listed again here. Can you explain what that means and what's going on there?
Sure. So we contract and we pay, Medic One funds 70 paramedics in those 3 fire agencies, and they're split up according to the geographical disposition for those fire agencies. When a paramedic comes down on disability, and we are contractually required to pay their disability costs plus the backfill to staff that position. And that's typically overtime, mandatory overtime for another paramedic to go into that position. And so those costs are associated with that, and it's going up significantly over the past 3 years.
And I guess I'm still, is this several different things bundled together? I mean, I understand when contract costs go up or whatnot, but that seems like a high amount. And then you've got you've got several other things listed that don't seem to be related to contract provisions. So are you bundling kind of a bucket of things together?
Yes, sir. Excuse me. And so let me clarify. The contracts themselves cover all the costs that are associated with the paramedics. They not only disability but salaries. They provide for other expenditures, benefits, FICA from the employer's perspective, and also Social Security from the employer's perspective. So all those costs to employ someone are part of those contracts. Disability is part of that. What we're just pointing out that is disability has significantly increased, and it'll hit over $770,000 this year, and it went up from the previous years below $500,000. So it's had a significant impact to those contracts.
And that's going to double again in the needed amount that's needed in 2023. Why is that? Why does that double?
Yeah, hold on. Let me. So the cost here is labor costs. So the cost for salaries, benefits, disability costs, as well as some of those other areas I talked about. So it's the package deal to employ someone. So when you have 70 paramedics and their labor costs are going up, and their disability costs are going up, and their benefit costs are going up, that's all part of these contracts.
Is it going to be in 2024, 1.5 million, in 2025, 2 million? I mean, is this a one-time, like we get over a hump, or is this just like we're under budgeted? I mean, that seems weird that what you're describing would double in the next year.
So yes, we're not sure. I'll be honest with you, we're not sure. Our costs, like I said, in 2019 went up significantly in 2020. We thought it was a COVID bump, and we didn't anticipate it to go up again. And this year, it's still going up. So we are not clear what is driving the disability costs, other than paramedics are coming down with disability, they're coming down with injuries, they're coming down with sick illness. Only 1 or 2 paramedics are actually coming down with COVID diagnosed disabilities. The rest are more than likely what we've tried to determine is a high op tempo. So there's a lot of mandatory overtime for paramedics because call volumes have increased. So there's a whole lot that goes into it, but the bottom line is disability costs are going up, and those are a third-party determined cost. In other words, like as an example, Labor and Industries is one of the providers for one of the agencies, and they make the determination on a disability. The agency itself does not.
Kurt, with all due respect, the question remains. Meaning in 2022 is 500,000 to cover everything that you just described.
Correct.
And that I assume takes into account the 250% increase that you received in 2021. But the question remains is the jump from 500,000 in 2022 to $1 million in 2023.
So keep in mind the 500,000 that's in 2022 is part of the $1 million in 2023. So in other words, in order to maintain that maintenance level, the 500,000 goes into 2022, and correct me if I'm wrong, Robin, but that 500,000 carries over because we will still have that cost in 2023 with the increase.
Yes. And so why does it go up another $500,000 in that year?
Because labor contracts will go up for the 70 paramedics. Also, disability costs we're anticipating will go up as well, and just overall costs will go up due to inflation.
Okay, you may want to take another look at that jump, because I understand the carryover from 2022 to 2023 for the 500,000, but an additional 500,000 in 2023 doesn't seem to justify based on the description that you provided.
Okay, so the ALS contracts are $9.25 million. So the 500,000 is just a little over 5% increase. That 2023 increase is a little over 5%. Right now, inflation is running at 5.9% for this year, starting at January 1st, 2022. So the numbers that we're talking about are not out of line with the inflation costs that we're seeing.
Commissioner Edwards has his hand
I was just gonna point that out. How many employees do you have, Kurt?
The number of paramedics are 70 that we're paying for in the 3 fire agencies. And so the contracts themselves this year are budgeted at 9.25 million. And again, it's a little over 5% for 2022 jump, but from 2022 to 2023, it's another 5%. But inflation this year is 5.9% that just came out officially, I want to say yesterday or today.
And then, didn't maybe a year or so ago, we, I don't know, budgeted some ungodly amount for electric gurneys because of injuries to folks that we were faced with, right?
Right. We were taking mitigation measures to reduce back injuries, which were driving some of the L&I costs as well.
I was just gonna point out that we have so many it's just unimaginable, the cost of doing business. The fire authority, medical folks, all those folks, they have the best contracts in the world. They really do. And this is an example of that. That's all.
Hey Kurt,
Yes?
where is all the revenue on these pages coming from?
It's coming from the Medic One Fund.
But where is the revenue coming from to go into the Medic One Fund?
Oh, the property tax, the Medic One property tax.
So this revenue isn't tied to these items. This revenue is gonna come in regardless.
Correct.
All right, so that's just a weirdness.
Don't you wish we had that kind of revenue? Do you wish we had voters that would support us at 60-some%?
Yeah, I do. but-
Trust, it's all about trust. You've heard me say that a few times.
Yes, sir. We have.
Okay, other questions related to priority 6?
No, let's keep going.
Okay, sir. All right, priority 7, this is basic life support, increased operating costs. This priority level is different than the priority 5, which was financial support to fire agencies. And this is for the Medic One BLS programs. Priority 5 financial support to fire agencies is direct financial support to the 12 fire agencies. Since most of the changes here are increased costs, I'm going to touch on extra help and professional services, but we'll answer obviously all the other questions you have on this policy level request. Extra help is used for CPR, AED, and EMT training, and Medic One uses patient role players for this. The patient role players at the extra help are currently paid $14 an hour, and this policy level request increases their wage to $16 an hour. These role players are required to be EMT certified, and the increase is necessary to remain competitive. Additionally, the role players and additional role players are needed in future starting next year, due to the increased demand for additional training resources from the pandemic. We have spread out the number of locations where we conduct training, as an example, for initial EMT classes because of the pandemic and to maintain social distancing. The next piece, professional services, they're needed for the increased operating costs for the medical program director, the National Registry for EMTs, Thurston County Medical Protocol Update, that's also known as ACID REMAP, and the Safe Kids program. And the outcomes here are extra help that receives competitive pay, continued non-COVID vaccinations for EMS personnel, CPR and AED training that lead to a trained public, because what we found is 74% of cardiac arrests occur in the home. So we feel the more we can train the public, the more they can respond to a cardiac arrest that happens in their home.
Amira?
Hey, Kurt.
Yes, sir.
Can you give me a perspective on the priority 7? You have 86,501 extra help for training. How that relates to priority number 3, where you're recommending hiring a full-time trainer?
So this training, as an example, we have over 100 extra help personnel who are our trainers and evaluators that go out to the 12 fire agencies and train and evaluate the 500 EMTs that are out in the county. The additional person, the SCI, the senior EMS instructor would be the person over this extra help that would train them, recruit them, and teach them. Plus, they would also be the SCI that's required for initial EMT courses that's required by the State Department of Health. And again, our initial EMT training requirements have ballooned, and they've increased to the point where we need to bring on someone full-time to be able to conduct those. We're losing our SCI part-time help. We're not replacing them. And it's not that we're not trying to replace them. There is no appetite, or I shouldn't say appetite, but everybody out there has a high op tempo in the various 12 fire agencies. And so we're not able to bring in people who want to be trained as SCIs in addition to their full-time job. So the difference here is the people here, the extra help, they're the ones who actually do the training and do the evaluating for the 500 EMTs that are out there. And there's a little over 100, I want to say about 125 that we have.
It's pretty extensive.
Extra.
I'm curious, and this is nothing you need right this minute, but how much are the contracts with the fire agencies this year? And how much will they be in the next 2 years in total? And not looking for an answer right now, but maybe that's something we can follow up with.
Okay. We'll follow up with you on that.
Yep.
Other questions on priority 7?
You've got like 2 minutes left.
I bet he can cover it.
Okay, so the next slide, priority 8 is non-contract advanced life support increased operating costs. There's a whole long list there, but essentially most of this is increased costs for operations due to increased medical services and or cost of living. And you have the numbers there in front of you for the expenditure amount for 2022 and 2023. Medic One, ER&R, we talked about that previously, and I think this is no surprise to anyone that we need to replace aging medical equipment. $375,000 in 2022 and just under $2 million in 2023. And then a small amount for increased administrative costs for Medic One. And then moving into emergency management, I'm going to, a number of the emergency management policy level requests are federal funds and federal grants that we want to receive. I want to go down into the top ones, which are the ones that we deem critical. This is a breakout, and I will tell you that general fund makes up the majority of emergency management, but you see federal grants are 42% and 29% respectively. You can look at the challenges for emergency management, but I will tell you, and the ECC activations, and but also I want to talk about our increased operating costs. We have not adjusted the maintenance and operation budget authority for emergency management since 2016, and we're just asking for $8,300 and change for the increased operating costs for emergency management. And then the next two are really critical. Emergency management language access assistance. Recipients of federal funding are required to comply with Title VI that states in part that no one is unjustly denied vital information, services, or assistance when their well-being may be at risk. RCW 3852 additionally requires local jurisdictions to provide information during emergencies and disasters for those with limited English proficiency. That was a law change that occurred, I want to say, in 2018. And so we went to the prosecuting attorney's office, and it was determined that Thurston County is required to translate vital information in Vietnamese and Spanish based on the RCW. So the funding that's being requested here will cover the translation services and outreach to limited English proficiency communities and meets the requirement under federal and state statute.
Wait,
Was there?
You had it on the wrong one. Or you have it on the wrong one on there. There you go.
Oh, I'm sorry. My apologies. This is the one that will take care of the limited English proficiency.
okay.
And so, questions on this one? Okay, and then EM funding for retirement leave buyout, we have while I've been verbally informed by a number of department personnel that are leaving, one has actually submitted paperwork. So their leave buyout is $18,828. They're federally funded. The federal grant will pay for half of it. That's $9,414. But since they're federally funded, if we leave the position vacant to try to get a savings, it's still only federal funds that we're saving, and therefore it doesn't accumulate any general fund to be able to do the rest of the buyout. The last priority 4, priority 5, and priority 6 are federal grants that we're requesting placeholders for. And some of these have already been in front of the Board of County Commissioners, but the first one, priority 4, has not, but we're waiting for that to come through. And so, subject to your questions, this is the Emergency Services request for funding. How'd I do on time?
Not bad, but
Not bad.
Robin, 4, 5, and 6, are these like the tail end of the public health ones where
Grants.
we don't have a problem there
Yeah.
because it's just
This actually is revenue coming in. It
Right.
can only be used in
Expenditures, not
certain
just-
way.
other questions for Kurt? No? Okay, well, we go straight, thank you, Kurt.
Thank you, Kurt.
Thank you.
We
Good
go
job,
Straight
Joy.
into the last session.
Good job, Joy.
It looks like Robin will tell us.
Thank you.
Right. So, we are going to wrap up by going through the rest of your other funds under the commissioners. And seeing how it's been a very long and jam-packed day with people talking very fast. I'm gonna try to focus on the ones that are of most interest to you. When we started this, we already reviewed detention, sales tax, the trial court improvement fund. We looked at the stadium convention center financial plan.
Are we on Commissioner's tab or?
Yeah.
Commissioners,
Commissioners
yep,
tab.
commissioners
What
fund.
page in Commissioner?
27.
The main
So
fund.
this is the funds that you're going
Right here. Okay, got it. Okay,
And back here are the
Okay.
okay. Thank you.
Yep, and we already saw a few of them. So we looked at conservation futures. I would just, since now you've heard from CPED, I would note that on conservation futures, if you look under 2022 and 2023, under expenditures, way down in the corner here, you'll see.
Which page are you on?
This is
Conservation
conservation
futures.
futures fund.
1380.
Yeah, they're in.
I got it, there I got it, right here.
All right.
I got a note on mine that says done. We didn't,
You did this one, I just wanted to point out, because Josh talked about the $1 million for acquisition. This is where it shows up, $1 million in '22, $1 million in '23. And you still have substantial fund balance left in
Okay.
this fund. All I wanted to say. Ta-da. So the next one is TCOM 911. It is a variety of taxes that the county collects and passes straight through to TCOM. The next one is.
it's gonna be pretty flush too.
Oh my gosh, yes, it's coming in. And what we have
Don't you
started
wish we
doing,
could do
because
that?
again, you heard us with the TBA, they couldn't collect $1 until next year. It was more than $1 that we were short for TCOM 911 that had to roll into a future year. So we estimate high and we pass through exactly what we get. The public education and government, or PEG money, is money that we get as part of the franchise fees in connection with the Comcast franchise. You see that it's coming in right around $105,000 a year. We expect that to continue very flat. We have a contract with TC Media. What the expenditure that you see here is the contractual pass-through into future years. you want to say something there?
Yeah, and so the contract ends at the end of 2022. And the county, the other partner jurisdictions, and I briefly mentioned this to the board months ago, we were contemplating going with a request for proposals to secure the services for the future vendor, whether it's TC Media or others. So you will see that coming early next year, just to give you a heads up how that connects to this.
Okay, but when you say that, I mean, it's not like, I mean, who are the choices? It's like there's the state one. You have to have access to a television channel or
Right.
the ability to
Right.
broadcast. I mean, you're not dealing with, 50 different, contractors. There's really probably only one or two that can.
Only 2 or 3.
So we'll see maybe two, and one may decide they don't want to do it, and we might see one or two proposals.
Yeah, I suspect we'll see two for sure.
And this fund is growing, it looks like. We're spending half of what we bring in each year.
The contract is that we will give half of what we receive to TC Media. And what you see though, I mean, if you look at 2018, we passed $301,000 and almost got this fund down to nothing. And this supported some major renovation work that TC Media did at their facility. There also, you see in 2017, $390,000. It's OT, stands for Operating Transfer to Property Maintenance Reserve. That was to do a lot of the IT upgrades in this room. So we spend this money in big chunks when we need to. And you want to build we're saving up for whatever the next big thing is.
Okay.
And it must be used on equipment that facilitates access to government.
Let me, being we're talking about that, did we ever go any farther on that? And I don't know the name of it, where there's a council sitting here and you've got that sitting down at the Rainier City Hall or whatever, and we've got a similar thing here, and yeah, but it's not quite the same as this. We got it farmed out different places for off-site meetings or something.
Yeah, Brian is exploring that option.
Oh, that.
Yeah,
You're
I mean,
talking
I don't know
about-
where we're at on it, because we haven't had an
You're
update.
talking about the tablet that actually brings and encompasses.
I know
the
it,
program?
I don't know the name of it.
It was the.
Yeah, it follows,
the
that's right,
Facebook-
it follows you around.
The
What is it?
Facebook tablet that you were talking about,
what
the
is that?
Facebook one.
Facebook tablet.
Yeah, it follows you
Yeah.
around.
Yeah, I mean, it's just like almost like being there for you.
Yeah, because you're right, if you set the tablet here, if you move in the room, it follows you.
Yeah,
Yeah, so Brian's exploring that, for sure. So-
okay, just more to come. Okay,
Yes.
good enough, that's all. That might be one of those expenditures.
I don't know if I want a camera following me. That's a different story.
I think you got one on you almost all the time.
Probably.
Equipment that facilitates access by the public
Mhm.
to their government.
Okay,
All right, Tourism Promotion Fund, 1920. The revenue is the midnight. You just had the presentation by the BCB. This is the money that's passed through to them. It's been growing pretty steady until we hit 2020. You can see in the revenue the substantial hits that the industry took due to COVID, but it's bouncing back like the rest of the economy. And we just pass the money straight through to the BCB. And they use it for all the good things you heard about on Monday.
You could build a couple of motels down there off Indian property in Grand Mountain with help.
Fund 1930 is the Historic Preservation Fund. One of the things you heard request for was funding to produce the Historic Journal. It would come out of this fund. You have a grant program that goes out of this fund. The fund balance is growing. By the way, the revenue source is a $1 surcharge on documents that are filed. So it's $1 per document that come into this fund, roughly 75,000, which might be a little low because right now it's super high. But we're recommending that you increase the historic grants up to 26,000 a year and start to burn this fund, and you could do more. So this is the fund, Commissioner Mejia, that you could use to make a nominal contribution to the Tumwater Brewer.
Is there
Yeah, it's just not a lot of money. Not a lot of expense. REIT 1, you've heard a lot about REIT 1. It's real estate excise tax. It is 1/4 of 1% of the sales price of the property. And so we are anticipating this year, you'll see that the revenue has just been growing exponentially. We're estimating this year we'll collect $4.5 million. I think $5 million next year is a very conservative estimate because the market is hot and it's not slowing down anytime soon. The purchase of Mottman, we took a loan to purchase Mottman and we'll need to pay it back in 2023, but we'll pay it back on the bond that you authorize. That's part of the plan. If you don't issue a bond, we won't be making the bond payments in the future, and we'll just pay it back out of this fund. This projection includes $10 million in improvements at the atrium, and it includes bonds, and I think I've got $55 million of 30-year bonds starting halfway through 2022. Yes.
I'd relate to the amendment. You have that 5.6 on the expenditures in 2021.
That's because we bought the building. Yeah, we spent that money.
It seems to be the transfer to the ER&R, and the payout is in 2021.
No, the expenditure in 2021 was to pay for the building, and you see the revenue coming in from ER&R. You don't.
Okay, I see the revenue. Okay, got it.
Yeah, you don't see the payout in 2023 because we'll do that from bond proceeds.
Right.
And all we do out of this fund is make the bond payments. So not gonna issue bonds without your authorization, and we're working on the plan for the work that would be done on these buildings. That's what the bond would support.
So in the bond, the payout assumes a $50 million bond.
$55 million.
$55 million. So that gives you perspective that even on the $55 million bond payout that begins in 2022, look at the end of fund balance.
Yeah.
So this is a very robust fund that gives the board opportunities to find other type of facilities.
Right. So should we need to do something for the sheriff's evidence or some such thing? There's a little bit of room here to do things like that.
Model a dormitory for us.
Maybe the improvements on the courthouse may be a little higher. So that gives you latitude.
Yeah. So that's REIT 1. REIT 2, I apologize that the print is so very small. The funding source is exactly the same, 1/4 of 1%. By the way, REIT 1 is also called
You're doubling up.
first quarter REIT. That's why it's REIT 1. It's the first 0.25%, and REIT 2 is second quarter REIT. That's how they got their names. So same exact amount of money coming in.
0.25.
0.25 of, this is the first 0.25, first quarter REIT. Second 0.25, second quarter REIT. REIT 1 or REIT 2.
And then what about third and fourth?
There are no third and fourth quarters.
We wish.
If there were.
I'm not good at math,
we'd
guys,
roll it in
but-
the money.
Wishful thinking.
So, second quarter REIT, same amount of money coming in, just rolling in like crazy. And what you see here is second quarter REIT can be spent on infrastructure projects. And I call them external facing. They're community projects. They cannot be spent on county-owned facilities. So sidewalks, roads, sewer systems, water systems,
Parks.
lighting, parks, major maintenance of parks, not operating costs. You know, it's those public works things, stormwater systems, that you can spend REIT 2 on.
I just got dizzy from like, but why is there such a big hit in 2023?
On the expenditure side,
Yeah, that it goes from
40 million.
8, yeah.
because, and again, these are public works projects, so you see all of the projects that Public Works is proposing to pay out of REIT 2.
So the gray lines up above, those are all the projects, and that's where you see the majority of the increase.
2 million for Fish Passage, 2.5 for Black Lake Bridge repair,
Yep,
$1 million for
The woodland
overlay.
creek, yeah.
2 million for Grand Mound.
So it's just like when the
Capital
projects
reserve.
kind of get,
That Black Lake Bridge repair, is that going over that swampy peat bog?
Yeah, that is such a.
That's been a money pit
It's
for
a
as
money
long as
pit.
I've been around here.
Yeah, because the bridge is
Just
solid.
keep settling.
No, the bridge is solid,
Yeah.
the approaches are the one that's settling.
Yeah, just settle down.
So these are public works projects, and you can, even with all of these things that Public Works has proposed, you still have a large fund balance in this fund, and there are opportunities here. So think about what kind of significant community projects that are infrastructure, public works type projects that would benefit the county. It has to be in the unincorporated area. You can partner with the cities, but it has to be an unincorporated county.
got any good ideas?
No, but I have, on that Black Lake Bridge I do, it's called improvised airport landing strips for desert and swamp. And I did it when I was in the Army, and it's just plates that have holes in them, and you lay it out across there, then. Boy, it'd be a cheap fix. Not quite as cheap as a rail car on some of the bridges, but
But very much like when we had some capacity to do the culvert projects for fish passage, there's room here if you should want to do something that would support unincorporated.
Something that, the board has invested, aside from the bridge, from the fish barrier removal project, up $2 million, is a very robust overlay program. And that is really a very quick, very effective way to maintain roads in a 15-year window. So you have in here, from 2023, you have $1 million. You may consider 2022 adding additional money for overlay programs. The overlay program, it may be increasing, if you wish, in the future, the allocation for the overlay. Because if there's any investment that we need to do toward roads is on the maintenance. Maintain what we have. And I believe this program can,
No maintenance.
no, but maintaining the roadway is.
But we
is an
might
improvement.
get some federal money, use this for seed money for match for,
Because they,
Good, yes.
we might.
because the overlay is an improvement.
What about those really, there's a whole bunch of projects that connect to trying to create a capital-to-capital trail system and then taking that trail down to like Rochester and,
Yes,
and meeting the Chehalis.
you absolutely
Yeah.
could use
I
REIT
mean,
2 for
we could
that.
really jumpstart some of that.
Yeah. You can actually put some seed money to extend the trail system.
Well, we tore the track, remember we tore
Yeah,
that stuff up
the-
going south?
Belmore?
Yeah.
Get Belmore? Yeah.
Burfoot, I was thinking of like things that we'd done, and lo and behold, there's Burfoot restroom, but I thought that one, it only shows about 70,000. I thought that had gone up to like, were we matching money from somewhere else there?
No,
Park
the park
fees?
impact fees.
Oh, okay, so just
This is just free.
the REIT 2 park, yeah, because that project was more than 400.
Yeah.
some
And the
thousand.
same as the overlay program, the roads fund also funds that. So this just funds a portion of it.
Fry Cove Lawn, yes, we're hitting our park, capital projects.
Right.
And we also had a couple of proposals that I threw out there that I'd heard about from Ralph Monroe.
Yeah, and that would be an option because I asked Jennifer to put on the long range planning. That does really is a good opportunity for you, for the board to consider those.
Okay.
And those will be proposed? Is that what? you
If
just
we
said?
hear some direction from you, we will
Yeah, we'll.
pull something together on them.
Well, tomorrow we can talk about it, some of the work
What
sessions.
what's the suggestion of like what we, like, in terms
How
of
much
spending this
room?
down, like, yeah, like how much should we be thinking about in terms of keeping this fund balanced out?
I haven't run that number yet. I'm thinking that if you spend if you wanted to front load something, you've got about $4 million to spend. If you wanted to set up something over time, like you did the Fish Passage project, I'd say you've probably got room for about $1 million, $1.5 million, but I'd want to run the numbers.
Where are we at on that fairground project to build that facilities to start producing revenue?
So that's out of REIT 1. We could not use REIT 2 for that because that's a county-owned facility. And Josh is working with the fair committee to come up with what the cost of the proposal is.
Yeah, I mean, I think road overlay and things related to trails.
Right,
is really-
and my recommendation is for the board to consider, if it's a one-time investment, you can really make a difference on the trails. Because then you will probably consider closing the gaps. And the Gate Belmore, for instance, the right-of-way is in place, it's ours. The railroad tracks
Most of
have
the
been,
work is done.
the railroad tracks have been removed, it's just the improvement. Whether, $3-4 million is enough, no, but you can certainly approach that.
If you use railroad cars on those crossings, it would be enough. I mean, it would.
So for you to consider, that may be what I call a signature project for the board to consider improving the trail system.
Yeah, I mean, and I'd like the board to see, since there is the potential, I'd like them to see some of the things that was given to me, that I gave to you and Jennifer about what, Ralph Monroe's things, and some of it related to the trail we have now, some of it was like a parking bathroom, then there was a couple things like on the McLean part, connecting the McLean out to where the fish can be seen for the kid, like that would be like an educational. You connect the McLean Trail that exists out to the, I forget what they call it, Alistair.
We can get
Allison Springs or
we can
something.
get that RCO money to do that too, and have seed money, so we don't have to put it all out.
Just some of those things so that we can sort of weigh it all together. but-
You'd also want to put in a couple of dollars of conservation futures, just so the M&O money
Yeah,
can
could
be
be
spent to
Yeah.
maintain it.
Yeah.
Yeah.
Working,
I'll work with Jennifer Westphal.
okay,
Yeah.
High level, we will not be able to give you
yeah.
details because of time.
Right. So this last page is just the one-year plan for the courthouse fund. We're using that to pay for the project manager. There's about $500,000 sitting in this fund. once these projects get going, currently they're paid for with central services, but we'll start charging the admin costs for these projects to the capital fund. And that's all of them.
Just about like the plan to sort of, if we were gonna have a new courthouse, is that what this is about when you say
Yeah,
courthouse?
courthouse. It's whatever projects are
But it can
related
apply to what
directly
we're gonna
to,
do
yep, courthouse, yep. What we're gonna do on the Hill, whatever we do at Hoffman, that's what I charged my project manager to.
So what the RFQ or queue is closing for the.
I thought that, I'll ask Chris. I don't know. I will have to ask Chris. I've been working on so many things that I can't pull it out of my head.
Okay, so what else do we need to accomplish today?
That is it for your other funds, and it's been a long day, and just thank you for,
A lot of information today, so thank you.
yeah, tons of information today.
And we still anticipate, as I understand it, not needing Friday afternoon after 12:15 or something?
That's right, and Romero just said that we really need to wrap up by 12, and I think we can do that. So Friday is the makeup day, if you will, for offices or departments that needed to move from where they'd been scheduled. So you'll hear from the assessor on Friday morning, Superior Court, Juvenile Court, and then I'll just outline the next steps and we can call it a day.
Sounds great. All right, 4:14, we are adjourned.
All right.